Hey there friend, Christina here with NursingSchoolOfSuccess.com, and in this video we're going to talk about nursing school care plans and how to write them. So if you're confused on how to write great nursing school care plans, or it's taking you a gazillion hours to write them, then this video is for you, my friend, because I'm going to walk you through 3 tips to help you ace your nursing school care plans. Alright, so care plans are one of those things that you just cannot avoid in nursing school. You will write them pretty much every day of your life. And the earlier that you figure out how to write care plans, the better off you will be, because you will save so much time stressing about them in nursing school. So in this video, we're going to cover 3 tips to help you write amazing nursing school care plans. Alright, so care plan tip number 1, the related to is just about always related to the pathophysiology of what's happening with the disorder that your patient has. So when you're coming up with your related to factors, you have to be thinking of the underlying pathophysiology or what's going on with your patient. It all starts with the pathophysiology. So I get super excited about this because you know how much I love patho. So let's say, for example, you have a patient with type 2 diabetes. The related to factor, the RT, would be something like inadequate insulin production or insulin resistance, because those 2 things have to do with the underlying pathophysiology of what's happening with the disorder with that type 2 diabetes. So here's where we go back around to how to study med-surg. It is super important that you understand the pathophysiology first before you can learn everything else. And if you need a refresher on how to study med-surg, definitely check out the video we've got on that for you, because I dive in deeper into this concept and how to study med-surg so you can actually save a ton of time studying simply by understanding the pathophysiology of the disorders that you're learning about first. It's going to save you a ton of time, so definitely check that video out. So that's tip number 1. The related to part of the nursing care plan is the underlying pathophysiology. It's somehow related to that pathophysiology of the disorder. Now, tip number 2 for writing amazing nursing school care plans is that the goals that you create for your patient in your care plan must be patient specific. And here are 2 things that you need to make sure are a part of your patient goals. The first is that they're about the patient. They're written as what the patient will do. So your care plan goals should be written as the patient will. And now the second thing that your nursing school care plans must have is that the goals must be SMART. So SMART is the acronym that stands for specific, measurable, achievable, relevant, and time-bound. So let's talk a little bit about these 2 things. So when you are writing your goals for your patient, you must make sure that they're written as the patient will, not the nurse will. So these are patient goals. What will the patient do? What will the patient achieve? Not what will the nurse do, or what's the nurse going to do about it? No. Goals here are written as what the patient will do. And second, they need to be SMART, like we talked about: specific, measurable, achievable, relevant, and time-bound. So the SMART acronym means that the goals you are setting for your patient can be measured, so you know when they've achieved them, that they are relevant for that specific patient, and that they're achievable or realistic for that specific patient, and that they're time-bound. So you're not picking a random goal out of nowhere, but you're intentionally choosing a goal that aligns with what your patient wants to achieve and what is best in the best interest of their health. And of course, these goals need to be time-bound, so anytime that you create a goal for your patient, remember, we're going to start with the patient will, and then you're going to close that goal by the date and the time. So, for example, I could create a goal that says the patient will walk 10 feet from the chair to the bathroom and back 3 times by 1700 tomorrow. That is specific. I tell you exactly what the patient is going to do. It's measurable because there's a number to it and I can actually track, okay, did the patient walk 10 feet or they didn't? And for the sake of the example, we'll just say that it's realistic for our pretend patient and it is time bound. I put a time on it, so by tomorrow, they are going to be able to do this. So that is the SMART goal framework, and that's how you'll structure your goals in your nursing school care plan. Start with the patient will and then end with a time, the date and time by when they will achieve that. And then finally, tip number 3 for writing amazing nursing school care plans is to make sure that the nursing interventions that you create are what you, the nursing student, will do. So our patient goals from before were what the patient will do, but now these nursing interventions are what you will do as the nursing student. So these are the nursing interventions. They should be written as the nurse will or the nursing student will. So for example, a nursing intervention could be written as the nurse will assess the patient's lung sounds every 4 hours and document that appropriately. Or the nurse will accurately record urine output every 2 hours. These interventions are written as what you, the nursing student, will do. So our goals from before are what the patient will do, but these nursing interventions are all about the nurse or the nursing student, what you will do. And those are your 3 tips, and really the most common mistakes I see a lot of nursing students make in their nursing school care plans. Make sure that the related to factor is related to the pathophysiology of the disorder. Make sure that the patient goals are written as what the patient will do. And also you'll need to make sure that they are SMART goals: specific, measurable, achievable, relevant, and time-bound. And you'll need to make sure that the nursing interventions that you choose and do are written as what the nurse will do or the nursing student will do. Now, if you need more help with nursing school care plans, of course I've got you covered. We have an entire care plan course inside of the Nursing SOS membership community where I literally walk you through step by step how to create and write a full nursing diagnosis, patient goals, and nursing interventions. Plus, there's tons of example care plans in there to give you a lot of ideas as well. So if you're sick of getting bad grades on your care plans or they're taking you more than a half hour to write, you really need to get into this course. It will help you get better grades in your nursing school care plans and save you a ton of time in the process. It's amazing. You're going to wish that you joined sooner. And as always, girlfriend, thank you so much for being here and for supporting everything that we do here on the Nursing School Show. I'm so appreciative of you. Thank you so much. Now go become the nurse that God created only you to be, and I'll catch you in the next video. Take care.